try to reason with somebody that has a delusion, forget it. It's not going to work. Because by definition, a delusion is something it's stuck on their minds. It's the first thing on their mind all the time. They can't get it off their mind. Interesting thing about delusions, we'll have a talk at some point on psychosis too, and I'll discuss this then, but when you treat delusions with medication, what happens, the way you know that you're helping with the medicine is not because the delusion goes away. Typically they continue to feel, or to be a little bit, at least to think that really did happen. Let's say it's somebody was after them, okay? Or let's say somebody had an affair, a spouse had an affair or something like that. They still believe that happened, but it's not the first thing on their mind all the time. It's not like they're talking about it all the time, they can't sleep because of it, things like that. That's how you know the medicines are working. So I think a lot of folks think, well, you should take it all away and the person ought to never have that thought again. It's probably not, because now it's in your memory.
My mom she has type 1.
Mm-hmm.
She had an episode where she was identifying certain people while she was at the hospital, saying, there's your cousin, and all the people, none of the people even looked like who she said they were.
Right.
There's your cousin Rick. He's a 20-year-old guy, but she's pointing to a man maybe 75. And there's
right.
That goes with it.
Yeah, it can. Yes, I mean that's a form of psychosis. That the person is thinking something to be true that isn't. So yeah, it can.
Don't you think it's hard for families sometimes to accept, like you said, if they've known you a certain way your whole life, say your husband or your kid,
right,
and then you're diagnosed,
and the family says no way.
No, I mean, this has been you all these years.
Right.
I think it's hard. I think it's hard on family. I think it's very hard on family.
I think so. I think the way that's the hardest is if it's like a type 2 kind of thing, because when the family sees mania, I mean, if Grandpa goes out and buys two trucks in one day, everybody knows something's wrong, right? I mean, I don't care. Anybody in this room knows something. If somebody's preaching on the street corner or pointing to people on the unit saying that's so and so, and they're not, everybody knows there's something wrong with that picture, right? The hypomania thing, I mean, like I said, that's just Aunt Sally. That's just Aunt Sally. Well, so she gets depressed every once in a while. That doesn't mean she's bipolar. She's just depressed, Well, the problem is, you treat the depression with an antidepressant, and then you make them. Sometimes it'll not necessarily make them fully manic, but it'll make them swing more, make the depressions worse, and you have to watch that kind of thing. And so it is hard on families. I think families
accept the diagnosis.
Yeah, and there's a lot of levels to that. Another level to why families have a hard time accepting it is because of all the stigma that there is.
Yeah.
That means there's some genetic or some flaw in our genes or in our family that is a weakness or whatever else. You know what I mean? Instead of thinking about it like, hey, so and so invented something, or was an excellent artist, or thinking the positives of it, we tend to think of all the negatives and stigmatize it, which isn't so good. I mean, we all have brains. We all have any of our brains, and anybody in this room can have some type of mental illness or some type of. We pushed anybody in this room hard enough, we can make them psychotic. You can make anybody psychotic, you can make anybody depressed. It's just a matter of how much does it take. If we put all of us through a certain amount of torture, not that I would do that, but let's say we did. People would get psychotic at different levels. Some people really early without too much torture. Some people would take a lot, but at some point everybody gets. It's too much. The brain just can't handle it. So I guess if you think of it that way, then maybe we should not stigmatize people as much, because it could happen to any of us. So as soon as you say, oh, look at so-and-so, he's crazy, it could be you next week,
What's the thyroid connection? Because I have read that a lot of people.
Yes.
Yeah. I never understood that.
Yeah, I should have.
Understand thyroid. So.
Well, your thyroid is a gland in your neck, and it secretes thyroid hormone, and we all have to have thyroid hormone to survive. Think of it sort of like, well, it kind of gives you your metabolism. Okay, so if you have too much thyroid hormone, your metabolism goes up, and the symptoms are exactly what you'd expect. Your heart rate goes higher. You get hot real easy. You can eat and now, don't anybody try this for some kind of diet, some kind of weight loss technique. But you can, some people have tried it, and it's not very healthy. But you can eat and not gain much weight. And when your thyroid And so when they're, on the other hand, though, when your thyroid is low, everything slows down. You get dry skin, you get constipation because your bowels slow down, your heart rate slows down, you get depressed, and when you get high in your thyroid, you can get kind of a lot of energy and maybe even anxiety, psychosis. You can have some of that. But when you get low, you get more of the depression. Your memory gets cloudy, and we talked about a low thyroid and Alzheimer's disease. It can look like Alzheimer's disease too, especially in an older person. But the link between thyroid and mood is just that. I mean, if it's too low, you can have more incidence of depression. One little interesting little thing about bipolar disorder, and this is to me, it sort of fascinates me. I don't know why this is. But you can have somebody who's bipolar and who's swinging a lot of their moods, and you try medicine, nothing seems to be working. And even though you check their thyroid and it looks dead on normal, if you treat them with a little bit of thyroid, sometimes it will help stabilize the mood when you use it with something like lithium or Depakote or something like that. I've had that work for me in a couple of patients where the thyroid seemed to stabilize their mood over what the lithium or the other medicines could do. I find that interesting. And it's not that I made the person too high in their thyroid. They were still in the normal range or just right on the edge of the normal range, but I made them higher than they were. And that may, for some reason, that affected their mood. There's a lot of other psychiatrists, and there's even some studies on that. So even with just plain depression, there are some studies with adding, if you have an antidepressant, this is somebody who doesn't have bipolar, just plain depression. So no ups, but just the downs. And if you add a little thyroid hormone, even if their thyroid is normal, you can boost the effect of the antidepressant and help them out of their depression. So thyroid's a great question. Yes, thyroid, especially if somebody has bipolar disorder and their thyroid level is abnormal,
I thought I read somewhere
you got to treat that.
That most bipolar or a lot of bipolar people do have thyroid problems. That it was common with bipolar, or maybe it's just happens.
Two things about. I mean, the question is there some, even though it looks normal when you do the blood test, is there some abnormality? Is maybe the level normal, but the body isn't able to use it like it should, or something like that? That's one question. I don't know the answer to that. Because, again, I'm saying, some of these folks are normal when you check them, but when you add the thyroid, they get better. Well, something's going on. I don't know what. The other issue is lithium. If you're on lithium for a long time, lithium looks like iodine, right? And iodine is used by your thyroid gland to make thyroid hormone. Lithium will compete with the iodine, and then some certain amount of people with lithium, actually a lot of people on lithium will sometimes drop their thyroid level down. It's not a permanent thing, and actually you just use the thyroid medicine. You add the thyroid medicine to treat that. So that could be another reason that another thing you read, that a lot of folks that have bipolar disorder are treated with lithium, and then their thyroid drops, and that may be something else you're talking about. Okay. I've brutalized you folks long enough. It's 20 after the hour. Yeah, thanks for great questions. Another great session. You guys asked a lot of great things. I appreciate it. And we'll see you in January, third Tuesday of January. And we'll talk, what are we talking about then? Anxiety disorders, I guess. We'll talk about anxiety disorders. Thanks, guys.